Hi, welcome to Fast Intelligent Care. This is our part 2 of Belinda Dwyer. She's an OT lecturer at Flinders University. So in our first part, we talked a little bit about her background in OT, as well as some challenges and wins within pressure care education. In our part 2, we're going to go a little bit through a bit more detail about student experiences with their placements. We've talked on our previous episode about the feedback that you've gotten from new grads now that they've started practicing after they've graduated. But what is the feedback that you're getting from students after placement? Because I'm assuming they're going to potentially different, not everyone's getting exactly the same experience, right?
No, they have a very broad range of experiences, reflective of, I suppose, OT scopes that we, So they range from mental health to pediatrics to acute care to aged care to community. So
one particular student doesn't necessarily get all of them, or do they get a chance at all categories?
I'm sure we'd love, and they'd probably love, except for the financial aspect of it, more placements. However, given the placement hosts need to run businesses and we've only got a finite time for student course, then they put in preferences and for placements that they'd like to attend.
Do students get a chance to learn from each other after they come back? Do they come back from placement, or is the placement the final thing?
They come back after, between the two placements. So and they come back to intensive learning. So there's a lot of collaboration between students.
So they do get to share a bit across. Like if they didn't, one student didn't necessarily get an experience with mental health, they do get a bit of that perspective. Okay, that's great. That's really good. So is there anything that you're noticing about pressure care that students are saying is different when they're in real clinical settings versus what they've learned? So potentially, because if you're thinking of universities, it's usually very up-to-date information. As latest pressure injury guidelines, things that maybe they're noticing isn't necessarily being they're not actually seeing it in clinical practice. Or do you feel like we're quite up to date with that?
I feel from the feedback from students, which is fairly superficial, obviously, so we don't just delve into pressure care, is that they are feeling like they are prepared from a theoretical point of view. I suppose from the new grads point of view, they can often go in, they're feeding back, they can often go into places where the resources are quite limited. And therefore they can sometimes find that a little bit challenging in terms of clinically reasoning within limited funds.
Yes.
But, as OTs, we do tend to promote thinking laterally, thinking about clinical reasoning as to how we can then get around that, occupational performance barrier or that issue. So, we hope that we've given them sufficient skills to be able to do that. And confidence.
And when they're going into placement, do they have specific tools, assessments, or resources that they really take with them, or are they purely focusing on those foundational principles? Or is there anything that, whether it's, like you said, those podcasts or stuff that they have access to?
So anything that they get at the university, they have. So the way that we work it is that they do have lectures and workshops, but then there's additional resources as well. So they have access to all of those, and certainly prior to their placement, they contact the supervisor to establish, what tools, etc. they need. So then they may have those resources at the university, but then the supervisors are providing those that support generally throughout. But in terms of establishing preparation skills and things that they need to undertake prior to actually commencing week one.
And the workshops that I've done, for example, with them, where it's looking at support surfaces, looking at it in a very practical way, does that help doing that before placement or after placement?
Before placement,
before
I think,
placement.
yes. So that way then at least they've got some concept of, I know that you introduce and you talk to the new kid on the block of the Purpose T tool,
Yes.
but we also look at sort of the Waterloo and the Braden, etc. So if we're talking about obviously pressure care, then they have those tools. They've been exposed to them, so they're not walking into a setting and then feeling like completely the new kid on the block. I mean, they're already feeling like the new kid on the block, but they feel that they've got some armour, I suppose, and some context to be able to then put these clients in.
Yeah, and I think that a good thing that I found with CPDs when I'm attending myself, it's really good if you can always immediately go and apply what you've just learned to kind of consolidate it. And I think with the Purpose T tool, with it being fairly new, at least to Australia, it probably helps the students to feel like they're bringing some knowledge to the placement that they place that they're working at might not actually have known about the tool, so they actually hopefully feel empowered, bring something new into it. Is there, in terms of pressure care, when we're looking at placements, if they are doing something like a mental health block, and will they completely miss out on seeing any pressure care people with pressure injuries?
I'm probably the wrong person to ask about that. It's probably more the placement coordinator. Look,
would they then just have those?
They have a broad range of
tick off
areas that they can and do see when they're out on placement. But I suppose if somebody has a mental health and followed by a paediatrics placement, then maybe they're not going to get the exposure to pressure care and acute care that perhaps somebody who's working in a hospital or an aged care facility or community setting with somebody with neurodegenerative conditions would see. So, but I suppose that's the nature of OT, isn't it? That we are so broad and we've got a broad scope.
Is there any advice that you'd give to a student that maybe has done a placement where they haven't actually got to do that, see a case where there's someone for pressure injury, they haven't necessarily been able to touch on pressure care, something that they could do to help prepare them, whether it's reaching out to students that they know that has done certain placements, or whether it's contacting suppliers?
I think it's about arming yourself with knowledge, isn't it? So revising what you've been provided at the university, being a curious learner. So suppliers are, as I've said, the suppliers are there to form a partnership. So dropping if you are going to be working in the pressure injury care area, go and visit a supplier, make a time, have a play in your own leisure time, ask questions, seek that information to prepare yourself. But also then when you're out, either on placement and certainly as a new grad, it's about seeking that supervision, discussing your findings, your clinical reasoning with people who've had that experience, because that's how we learn. That reflect and then reflect on that as well.
Yeah, and this might be a little bit off topic from what our conversation has gone through, but something that just question popped into my mind is, because when I was studying OT, which is like roughly now 6 years ago, we didn't have AI. Has that had any effect on how students have experienced education? Look,
AI certainly has impacted on, I suppose, student access to information. So, a few years ago, it all put the fear of God in us. Was that going to then overtake clinical reasoning? But then with experience, we've seen that AI gets things wrong. And I suppose in terms of our approach to AI in the learning sphere, we are very much encouraging students to use it as a thought partner, but really reinforcing that it does not replace our clinical reasoning. So it's acknowledging that AI is here to stay, and that we need to be using AI responsibly, but it can be used really effectively as a thought partner as opposed to providing clinical reasoning for our reports.
And has there been any creative ways that you've seen OTs use AI other than just clinical reasoning, whether it's resources or anything like that?
Resources tends to be quite a common use. So in this day and age, particularly with billables around, I'll talk about NDIS because a lot of OTs go into that area. Time is money, and if you've got the technology to actually develop a really robust, clear resource in a shorter amount of time, then you've got more time for clinical intervention. So it can be used really, really effectively there.
Yeah. Okay, so that is the end of our part 2, where we talked a little bit more about placement. We have now, we're going to end off our episode. We're going to go on to our part 3, which is looking at common gaps, strengths with new grads and with our students. And we'll see you on our next episode on Tuesday.